Good morning. It's 7 o'clock, and as promised, I'm coming to you live about something that is very important to you if you happen to be a person of color. I know it's early, and I got up, got a shower, put a little lipstick on so you all wouldn't have to catch me with my morning face, my full morning untouched face. I hope you are well. I hope that you are weathering the storms of this pandemic. Maybe I will say it as a pandemic, P-L-A-N-D-E-M-I-C. In this pandemic, there are several storms. There are physical, emotional, mental, spiritual, and financial storms. And I hope that you all are weathering them as best you can. Y'all come on around the table and get a cup of coffee. This is one of those wake up and smell the coffee moments. In a few days, a couple of days, some very red states here in the South have the full intention of reopening for business as usual. These decisions are driven by money and money alone. And if you are a part of a demographic that has all of a sudden been identified as being an at-risk demographic, you really, really need to realize that this might be a setup for the get-up. Okay? I want you to understand that Black people and Latino people, or people of color, have been identified as being more adversely affected by COVID-19 than any other population. COVID-19 does not discriminate. If you will go back a few weeks, you will see a post in which I clearly stated that the coronavirus would adversely affect more Black people and affect them more severely than any other demographic. Why? Because of systemic problems within and without our community. Now, those of us who suffer from underlying conditions or suffer with or fight underlying conditions are predisposed to have a harder time fighting and recovering from COVID-19 than a person who has no underlying health conditions. There are several underlying health conditions and lifestyle habits in our community: diabetes, heart disease, COPD, lung problems, asthma, cancer, obesity, smoking, drinking, lack of exercise. Those problems are prevalent within our community. They exist in other communities as well. There are also economic problems. Many of us in this community do not come from generational wealth. We're not rich people. We didn't come from rich families. Many of us may have come from strong, hardworking, solid families, but we are not more than one or two generations from achieving solid middle class status. So the financial impact is a big deal because a lot of our people work in jobs in which they do not have insurance. They are the working poor. They're not insured. So without insurance, your primary care is often a visit to the emergency room when you first notice symptoms that you can't ignore anymore. So if you look at the fact that we have underlying conditions in our community, lifestyle and diet habits that affect us because it is economic. You're not getting up going to the gym early in the morning if you have to be at work at 5 or 6 o'clock in the morning. If you're working hard all day and you're shouldered with the primary responsibilities of maintaining your household, there may be little time for spas and gyms and steam rooms. And the diet that a lot of people eat is economic driven, not choice driven. They eat what they can afford. The better choice of meats and the fresher produce may be out of their budget, and the amount that they can obtain within their budget may be limited. So don't just put it all on the fact that black people don't care about their health. Most of us out here are doing the best that we can. There are some of us who can go in and pick the freshest produce, the leaner cuts of meat. We have insurance or savings, investments, or cushion money as we call it. Many of us do not. And I will not vilify you because of your situation. What I will do is make a concerted effort with some other people to show you how to get out of that situation. But if you happen to be a person of color who has marginal income, who has a lower income, or your income may go to necessities and you don't have the luxuries of a lot of things. You don't even have a lot of money left to purchase insurance or pay high deductibles to even see doctors if you do have insurance. Many insurance plans on low-wage jobs aren't what you think they are. They don't cover as much as you think. So when you look at that, between economic limitations, lifestyle choices, and diseases or underlying causes, people of color have a deck stacking against them. Now, when they open these states, I advise you to continue to shelter in place as much as possible. I find it very interesting that nail salons and hair salons and certain businesses that cater to or derive a great source of their income from African Americans' money or discretionary money are opening. And my biggest fear is that we will mindlessly pack them in droves and risk our health, the health of our families, our elders, and our children. Look at my head. You don't think that I want to go and see my hairdresser? And honey, I have some on speed dial in every city that I've ever lived in. You don't think that I want to get in the chair of a master that can craft my hair? And this little bit of hair I ain't got much, but honey, let me tell you, it's in a condition right now. Look. But do you think I'm going to risk my life for that? No, because I'm going to tell you, this is a setup for the get up. First of all, I find it interesting that these red states in the South who have been notorious for voter suppression want to open the states back up in a time and immediately after when black people and people of color have been earmarked as being the ones most adversely affected by the COVID-19 crisis. Now, the most subtle and sad symptom of COVID-19 is not the respiratory problems that you experience. It's not the body aches. It's not the unrelenting fever. It's not the pressure that someone's sitting on your chest. It's not the shortness of breath and difficulty breathing. This right here, this little thin layer of epidermis called your skin is the most subtle and sad symptom of the COVID-19 crisis. See, this black, brown, pecan colored skin that I have is the symptom that they will see when you first present to your emergency rooms, your doctor's offices. Notice they're telling you don't come to the emergency room. They're telling you to call your primary physician. Well, a lot of people who don't have insurance don't have a primary physician. I have one. I have what I consider one of the top physicians in the state of Mississippi, if not the nation, who looks like me, who is a genius, and who listens to me when I tell him what's wrong with me. A lot of my people don't have access to that type of physician. And when you show up at the emergency room, they're telling you not to show up for a reason. Is it about overwhelming the system? That's some of it. That is some of it. But when you do try to battle your symptoms at home and you can't, and you show up at the emergency room, your respiratory rate, your lung sounds, your temperature, your general appearance, your malaise, your weakness is not going to be the first thing that they see. This is going to be the first thing that they see. They're going to see your black skin. I have worked in healthcare for over 2 decades. I have been a black registered nurse out here working, and the things that I see let me know that in America, medical apartheid still exists. Most of your emergency room staff will not be black. It's just how it is. I have worked all across the South. I've visited and been in emergency rooms all across this country. I have gone to some as a patient. I've gone to some to observe, and I've gone with colleagues who practice both medicine and nursing to observe and see what's going on. And the majority of emergency department staff are not black. You will see a few sprinkled in. The majority of intensive care or critical care units are not black. You will find 1 or 2 every now and then. I call them the privileged few, because most of your ICUs and emergency departments are not comprised of personnel of color. Now, if it's different in the hospital where you work, please let me know what hospital that is. So when you arrive at the emergency department, you have to realize that there will be people who will meet you who will see this. When they lie and tell you they don't see color, ask them how they match their clothes. They see it. Trust me, that is the first thing that they see about us. And not all are that way, but there are many who will base the type of care that they give you on this sign, on this symptom right here. So when you do try to stave off the symptoms, when you try to treat them at home and you can no longer bear the symptoms and you go to the emergency room, you may be met with the same fate of a family who buried a father and their grandfather and had other members of their family infected. And when they went to the hospital, they were turned away. An elderly black man in Detroit contracted the coronavirus. He died. His son got sick a week later after his father's symptoms. They turned him away from 3 hospitals. He died at home. His wife, on the day that he died, started experiencing symptoms. It took everything within her son's power, including contacting a relative who was in state politics, to get his mother admitted and treated. He also experienced symptoms. Their relative, who was a known public servant and politician, also had COVID-19 symptoms and referred them to a doctor that could help them. She even admits that had it not been for her name recognition, they may not have treated her so well. So here is the problem. A lot of our people are not being diagnosed with COVID-19 until they are well into the worst stages, because when they present to the emergency room with symptoms, they are told you have bronchitis, go home. This young man accounts and tells a story of how he went there knowing that 3 members of his family had positive COVID-19 diagnoses, and 2 of those people had already died. A white woman sat up there with a bellyache from eating sushi. They took her right on back and they treated her, and he sat there, waited and suffered. And his symptoms were still dismissed. His saddest and most subtle symptom was his black skin, and so it will be with you. Be very careful when these states open up that you not forget that you still need to be practicing sheltering in place as much as possible and social distancing as possible, because if you get sick, you will not be treated in the same manner as your white counterparts when you show up at these hospitals. If you die, they will issue some lame apology. They will swear before God and everybody that they think is holy that they didn't know you were that sick. And you will be just as dead and possibly have gone home and killed some of your family members. There are still healthcare disparities in America. Not so much because you don't have the insurance, because you got some poor white folk out here too. Not because of your dietary habits. I've treated white people with diabetes, heart disease, especially here in the South below the Mason-Dixon line. The diets of black people and the diets of white folk ain't that different. We all dine on good Southern cuisine. So I see hypertension, heart disease, diabetes and obesity and other underlying diseases in white folk too. The real problem, the reason why COVID-19 is affecting you more so is because they are denying you testing, because they're telling you that you need to just go home because you just have bronchitis or sinus problems. And if you get the test and you are sick, when you show up, you may not be treated the same. Never forget the Tuskegee Experiments. Never forget the deliberate indifference and disfranchisement of our people. Do you think it's going to change right now? No. So I'm asking you, I am begging you to please don't you rush out here in these streets when they reopen these states. When you see them people protesting about they need to reopen the state, look and see how many of them look like you. You don't see no black folks out there beating their chest talking about reopening anything. Even right now, some of you who are able to draw unemployment, you making more money with the emergency packet and your regular unemployment payment than you did when you was working. Now, some people going to go on here and get upset. Sit down somewhere and let God get through doing his business. But while God is doing his business, you better take care of your business and use good common sense. You ain't never, and yes, I said it, you ain't never been treated right in this country. Now, all of a sudden, you think they going to give? You better have some sense for yourself. Please. Your life literally depends on it. And a second wave is predicted to come this winter. I want y'all to get ready. We come from a resilient people. We are survivors. We are built to survive. But systemic racism is one of the things that has killed us. It has locked most of our people in ghettos, locked most of our people in food deserts, locked most of our people systemically and by design out of higher education, out of well-paying jobs, out of access to the things that they need. And then there are some of us who come with the bull sugar and promote the lies and withhold the truth from each other. Now, the Surgeon General said, if you're going to take care of yourself, do it for Big Mama. That's right. Don't take this stuff back home and kill Big Mama. But you better realize Big Mama made out of some good stuff and she passed it on to you. So I want you to control what you can in order to be strong enough to fight what you can't see and what you can't control. This pandemic, they couldn't do nothing about how it got started. But from the first day that we heard that it was here, the things that should have been done were not done. So now that you know this, what are you going to do for you? Stop waiting for the people who are trying to drown you to save you. Them same folks that bought us over here on them boats, they ain't finna put us in no life raft, honey. Wake up. I'm trying to drown you. I've been trying to drown you since day one. Now, all of a sudden, I'm going to throw you a lifeline. Baby, please. I'm putting these glasses on so I can see some of y'all comments. You better, in the words of my dear departed grandmother, Laurie Tucker, you better have some sense for yourself. In the words of my great aunt Callie Maul, I done told you now. Genocide, gentrification, voter suppression. Let me tell you something. Do you not know that there are people that will use anything to their advantage? Sadly, as deadly and as lethal as this crisis can be, there are factions of people who see this as a way to oppress voters, to suppress voting, to promote genocide and potentiate it, and kill you off so they can get your land in the cities. I've been thinking about it a long time. I just hadn't said it. I'm not a conspiracy theorist. Where it came from and how it got here is one thing, but now that it is here, don't you think that there are some people who will not use this as a vehicle to promote their agenda? And just like they're using what they got, you better have sense enough to use what you got. Just look around and pay attention. Don't let that $1,200 get you killed. $1,200 won't even bury you. And if anything, you need to start stealing up and getting you some insurance, because if you don't be careful, it won't be before long that they start changing the game of how you able to get insurance. They somewhere sitting up, getting up early. They on conference calls across the nation right now, on speakerphone, Skype, Zoom, and everything else, planning ways to make it harder for you to insure your life, your health, and everything else. Pharaoh dead, but his spirit is not. Jim Crow got a son named James Jr. And the same spirit of evil that wishes to do as much harm to us as possible still is loose and roaming free in this country. Live. Survive this so that we can start learning how to live. So that we can become the resilient people that we were meant to be. I want you to subscribe to my YouTube channel. I'm going to post a link in the title because I don't know what Facebook gonna do to my account after this happens. I might be in Facebook jail. My website is redvelvet.com. Go to my website, go through the pages. You will find on my website a link to my YouTube channel. Subscribe there so that if this video gets me put in jail, I can still stay in contact with you all. I just look like this. I ain't crazy for real. Black nurses who know how to take care of themselves and know how to navigate the healthcare system catch hell working as nurses. And until they find out that we're nurses and we know what to do, they don't treat us right. But I'm going to leave this with you. If you are experiencing symptoms or your loved ones are experiencing symptoms and you show up at one of these hospitals, you make sure that even though nobody can go in there with you, this is what I need you to do. I need you to record the exact date and time that you went to the hospital. The name of the hospital, the exact address, the date and the time that you got there. Write down what symptoms you were having. And if you're too sick, you have somebody to record it for you. Keep your phone on charge and with you. Record in your phone, texting or typing to anybody in your network what is going on with you. Record the names of the personnel that you come in contact with. Doctors, nurses, respiratory therapists, whoever. Let them know that they need to keep a record of the date, time, the hospital, the address, and what was going on with you when you got there, the first person you spoke to. Because hospitals keep logs of what personnel was working on what day in each department. And you will be able to go back and refer to that day. And baby, they may not tell you, but they'll be able to know who mistreated you. Your medical records are subpoenable. That means that a good lawyer can ask for them in court. So when you start going to these hospitals with yourself and your loved ones and they turn you away and you get sicker and you die or your folks die, you can hold somebody accountable. Because that's what I would do. And that is what I will be doing if I have to go to the doctor. Go to a hospital. People that don't give a damn about you when you well don't care no more about you when you sick. There used to be a saying, if a mule die, buy another one. If a die, hire another one. And there were some who would say that the only good is a dead one. You better believe that spirit is still out here. COVID-19 does not discriminate in how it affects or infects anybody. It is the secondary treatment. It is the secondary part that is killing our people and making us look as if we are collateral damage in a drive of greed, genocide, gentrification, voter roll purging, voter suppression, and everything else. Now, y'all think about that today. Think about that. Think. Your fingernails and hair can wait. You ain't going nowhere, no way. Go somewhere and sit down so you can survive this pandemic. I love you. I want to see you around. Take care of yourselves. Document what happens when you go to these places and they send you home. And if you have any questions, you can reach me by inbox. You can email me at redvelvet at live, L-I-V-E, or for this time, live, redvelvet@live.com. Visit me on my website and subscribe to my YouTube channel just in case anything happened to my Facebook account after sharing this truth with you. Y'all have a great day.